It's always a pleasure and fascinating in equal measures to welcome Professor Angus Dalgleish. Professor, thank you so much for coming back.
You're welcome.
Now, I believe you've just been doing a tour of Australia where you've been going around with Dr. Paul Merrick talking about all sorts of things. But someone recently said that you're just a oncologist. So what do you know about these other things as well? Maybe we should start off by looking at your qualifications to talk on this. What do these all stand for? MD?
Oh, that's just my thesis, which I did on retroviruses and cancer, which was mainly about HIV in the end.
Oh, right. So you know about viruses as well. Interesting. Good.
Yes.
And I think we should say all doctors in the States are MDs, but MDs are a postgraduate research degree in the UK.
Yes. My basic degree is MBBS, but I don't put that on, or a BSc in anatomy, because the MD supersedes it.
Correct, yeah.
So my MD is a thesis as opposed to a PhD. Mm-hmm. I mean, that's a thesis, but MD is a medical one.
Yeah, an MD is like a PhD for doctors, really, isn't it? Yeah. So what's FRCP?
Well, they just fellow the Royal College of Physicians and the Australian College of Physicians.
Yeah.
And then because of all my published work, I got elected to the Royal College of Pathologists, mm-hmm. and then the Academy of Medical Sciences. Again, that was on my research impact.
Yeah. So basically you have been at various times in your career, most recently basically an oncologist, professor of oncology. You've also been a virologist. You've also been a specialist in HIV. What have I missed out?
Immunology. I've been an NHS consultant in immunology and general medicine when I was at Northwick Park. Yeah. And then I did general oncology there as well, but I really became full-time oncology when I moved to St George's.
Mm-hmm. Yeah, good. So basically you're a lifelong physician and researcher and supervisor of research. So it seems reasonable that we at least take your opinion on various things and not dismiss you as someone did recently as just an oncologist. Not that there's anything wrong at all with being an oncologist.
Yeah.
Now, I have had a few complaints, Gus, I must say, from people in Australia that said that your time ran out too quickly. So tell me, what were you doing in Australia and who were you with?
All right. Well, first of all, we started in New Zealand. And we did big weekend conferences in Christchurch, and then we moved to Auckland. Mm-hmm. And then we went to Australia, where we did Brisbane, the Sunshine Coast, Sydney, Canberra, Adelaide, and then Melbourne. And it was quite a packed tour, I must say. Mm. But in both New Zealand and Australia, the most striking thing that hit me was the number of doctors and even nurses, paramedics who've been struck off for participating in treating patients when the whoever they were said, it says on the guidelines you don't treat people until they're blue and dying. When you're allowed to call an ambulance, you send them to hospital where they will put them on a ventilator and kill them. A number of people, sensible people challenged this and said, it is an airborne disease. Yeah. You should treat it like that. And I really that right from the very beginning. But to find people who'd been punished for this was just unbelievable. Talking to really good experienced doctors, I felt really sorry. And then there's the second wave of people who'd been sacked for either refusing to have the vaccine because they felt quite rightly they didn't need it. I mean, if you've had COVID, I argued this right from the beginning. Why do you need a vaccine if you've already had the disease? Yeah. You never give a vaccine if you've had a disease for anything other than, say, if you get rabies, and that's because you vaccinate before the thing takes off, and that's about the only time that I'm aware of. And then there were people who were struck off, GPs, for deciding, quite rightly, not to give the booster to patients who'd had such terrible reactions to the first two. Well, I mean, if you have a terrible reaction to a drug, you don't take it again just because it says this is what you have. No, you stop it completely and look for an alternative pathway.
This is incredible. I mean, if someone's allergic to penicillin, you'll get your red pen out on the top of the medicines card and write allergic to penicillin. And then you wouldn't expect someone to write up penicillin as the first drug to be prescribed. It's just incredible.
Yeah, all common sense went out the window with this. Not of the doctors. I would defend them to the end. It is all common sense, and how to manage this pandemic went out of the window from the very, very top of the government all the way down. And I am furious at all the agencies that supported this nonsense. The Royal Colleges, it's absolutely outrageous. The BMA and all the doctors' unions, etc. And people who run the NHS, the chief medical officer, all the way down to the chief medical officer of the trusts, they all fell for this. They must have known it was wrong. And that's what I couldn't understand. So the tour of New Zealand in particular opened my eyes to just how draconian these great doctors were. And of course, both in Australia and New Zealand, they're desperately short of doctors and nurses because they fired so many of them for being good. It is really dreadful.
Good clinicians need not apply. We'll just have a few crummy ones. It's just... Yeah, anyway, yep.